If iron interferes with the absorption, is it recommended to take an iron-free vitamin, like if you're on supplements, to avoid iron?
So the recommendation is to take levothyroxine separately from anything, including the vitamin and the other supplements, herbal supplements. Some of the medications are fine, but generally to stay clear, we recommend you take levothyroxine first thing in the morning, separately from the other medications. With iron, it's particularly concerning when you're on the iron supplement, when you are getting treated for example, iron deficiency anemia. Iron can decrease the absorption of levothyroxine by as much as 40% if you take those two together. There is an easy workaround. You just separate your levothyroxine and your iron pill by about 4 hours, and that should be okay. You can take both of them.
What about taking levothyroxine at night before bed on an empty stomach versus taking it in the morning?
Totally acceptable. If that fits your lifestyle, that's perfectly fine. There are some patients who say, well, I have to eat. I cannot take it without food. And even that is okay. We just have to adjust the dose, increase the dose to adjust for that. And as long as they take that levothyroxine consistently, even taking it with food might work, although it make it a little harder to maintain a steady dose.
Thanks for all the information. Is there any problem taking T4 and T3 at the same time, separate pills, or should the timing be separated? I've asked pharmacists and I've gotten different answers. Is it better to take T3 and T4 at the same time or to separate them?
It's okay to take them together.
Thank you.
What about our coffee and tea in the morning? Can we have that, or does it interfere with levothyroxine absorption?
It could interfere, especially if you like to put a creamer in your coffee. So yes, separated by at least 30 minutes. So this is some final practical recommendations. As we discussed, taking levothyroxine in the morning, at least 30 minutes before your morning meal or coffee is a preferred way of doing it. It's okay to do it in the evening as well, if that absolutely better for your lifestyle. But most of the patients find it easier to do it in the morning. I generally recommend you keep the bottle with your pills at your nightstand, and you get into the habit. You wake up first thing in the morning, you get the pill with your thyroid medication. It takes, for most of us, about 30 minutes to take our shower, brush our teeth before we actually get to our breakfast, and that's perfect. Then you're good to go and eat, and there won't be any problems with an absorption. Catch-up dosing, it's a very important concept. Levothyroxine has a long half-life. If you miss a dose, take 2 tablets next day. It's perfectly safe to do it.